Hi, I'm Dr. Monica Urilan, maxillofacial surgeon and hair transplant surgeon. Undergoing hair transplant procedure is an exciting step towards restoring your hair and confidence, but taking care and following proper care guidelines is a necessity. So let's walk you through the proper post-operative care guidelines and how to take care of your new grafts and scalp. For the first 48 hours after the procedure, you need to be little careful. Avoid touching, scratching, rubbing your scalp. Obviously, this will disrupt the newly implanted grafts. They need time to settle. Coming to the sleeping position, proper sleeping position is essential. A 45-degree sleeping position will ensure the newly implanted grafts remain undisturbed, and also it reduces the swelling after the surgery. Coming to smoking and alcohol, obviously they need to be refrained after the surgery for at least a period of 1 month, obviously more than that. It impairs the blood circulation towards your scalp. Obviously, it will hamper the healing after the surgery. Now coming to this activities like gymming, swimming, you need to refrain from all these physical activities at least for a period of 2 weeks. Immense sweating also has to be avoided for at least a period couple of months. After the surgery, you need to take few medications as prescribed by your doctor, like antibiotics, anti-inflammatory drugs for at least a period of 5 to 6 days. Wearing a cap is a necessity. Wear a surgical cap as prescribed by your doctor for a period of 5 to 7 days till your head wash. Itching can occur, and if itching occurs more, then you can visit your doctor for approved solutions. These are the basic post-operative care guidelines which you need to follow after the hair transplant procedure. If you have any queries, you can visit our clinic or any nearby Hairfree and Hairgrow Clinic. Thank you.